Good morning, ma'am. Good morning, class. Myself, Vaishali Ambelkar, student of MSc Nursing first year, PG College of Nursing. Today I am taking my seminar on the topic Care of Hospitalized Child. Let's start with introduction. Introduction. The sick child is different from sick adult. The differences of illness in children and adult are based on anatomical, physiological, immunological, psychosocial, cognitive differences between immature child and mature adult. They require specialized pediatric care from practiced professionals. The children's reaction to illness, perception to illness, body image are different and different age groups. Therefore, they need special attention during each stage to help them for appreciate growth and development. This is an image of Erickson's stage of psychosocial development. Now the definition. Hospitalization is admittance to the hospital as a patient. When we are going to hospital for any problem and we are getting admitted, this is called hospitalization. Now move on to meaning of illness and hospitalization to a child in a different age group. First is infant. Changes is familiar, routine and surrounding respond with global reaction, separation from love object. Toddlers, fear of separation, desertion, separation anxiety highest in the age group. In this age group, relates illness to a concrete condition, circumstances or behavior. Then preschool, fear of bodily harm or mutilation, means fear of injections, fear of pricking, castration, intuitive procedures, separation anxiety, less intense than toddler but strong. So school age, fear physical nature of illness, fears physical nature of illness, concern regarding separation from age mates and ability to maintain position in peer group. Then adolescence, anxious regarding loss of independence, control, identity, concern about privacy. This is the meaning of illness and hospitalization to a child according to her age group. Next, move on to child reaction to hospitalization and prolonged illness. What a child feels when he or she got admitted. The illness threatens both physiological and psychological development of a children. Sickness causes pain, restraints of movements, long sleepless periods, restrictions of feeds, separation from parents, home environment, peer groups, which may result in emotional trauma. The child may get frustrated, emotionally harassed. Then hospitalization and prolonged illness related growth and development and causes adverse reaction in the child based on stages of development. This means according to stage of development, different age group child reacts differently. First is reaction of neonate. Hospitalization and prolonged illness in neonate period interrupts in the early stage of development of a healthy mother-child relationship and family integration. impairment of bonding and trusting relationship, inability of parents to love and care for baby, and inability of baby to respond to parents and family members. This happens in neonatal period. Then next is reaction of infants. Infants' reaction are mainly separation anxiety and disturbance of individual of basic trust. Emotional withdrawal and depression are found in the infant of 4 to 8 months of age. Interference of growth and development is also found. Older infants have limited tolerance due to separation anxiety. Then move on to reaction of toddlers. Toddlers' reaction are found as protest, despair, denial, and regression. Toddler protest by frequent crying, shaking cribs, rejecting nurses, attention, urgent desire to find mother, showing sign of distrust with anger and fears. In denial, the child rates by accepting care without protest. Toddler reacts by regression in an attempt to control stress. Then move on to reaction of preschool child. The preschool children adopt various mental mechanisms to adjust with the stressful experience of hospitalization and prolonged illness. They react by exhibiting regression, repression, projection, displacement, identification, aggression, denial, withdrawal, and fantasy. Then move on to reaction of school age. School age children are concerned with fear, worry, mutilation, fantasies, modesty, and privacy. They react with different mechanisms like regression, separation anxiety, depression, phobia, unrealistic fear, suppression or denial of symptoms, conscious attempt of mature behavior. Sometimes kids say, I'm okay, I'm fine. That's like this. Now, reaction of adolescents. Adolescents are concerned with lack of privacy, separation from peer or family and school, interference with body image or independence or self concept and sexuality. They react with anxiety related to loss of control and insecurity in strange environments. This is all about child reaction to hospitalization and prolonged illness in different age groups. Now we move on to preparing the ill child and family for hospitalization. How you will prepare a child of different age group for hospitalization. First of all, preparing a infant. Change in family routine and surrounding. Respond with global reaction. Separation from love objects. Preparing the infant. As because the infant cannot understand, explanation preparation has to be minimal. Special items such as favorite toy, blanket should be packed. The object provide care. Gift should spend a great deal of time with an infant. Now move on to preparation of a toddler or preschooler. Three chief fear of toddler and preschooler are fear of unknown, fear of abandonment and separation, and fear of mutilation. These children need preparation clearly aimed at achieving these fears. Bringing a favorite toy can be helpful. Child could be encouraged to play in hospital with dolls or any favorite object or toy. Next, preparing school age and adolescents. Both school age and adolescent need factual explanation of what will happening and what will happen during hospitalization. A hospital orientation program which in which facts of hospitalization are discussed. Interact with interact with the child interact the child with another child who had undergone through the same condition. Now, preparing the child of a different culture background. Make the assurance that proper care will be provided to the child without any differences. Any without any differences and discriminations. Preparing disabled and chronically ill child. Help children to maintain a contact with their family and school friends during a long hospitalization period, as they are staying in hospital a long long term care through phone calls, letters, and open visit by the friends and close family members should be allowed. Next, we will move on to what are the risk factors of hospitalization. First is, it has also been noted that rural children exhibit significantly greater degree of psychological upset than urban children, because urban children are familiar with the hospital. Okay, you understand? Okay. Next is, the stressors of hospitalization may cause young children to experience short and long term negative outcomes. Third is, supportive practices such as family centered care and frequent family visiting may lessen the mental effect of such admissions. Fourth, infants may be emotionally disturbed by hospitalization. Fifth is, not only they are separated from parents, but also they will have sensory deprivations if the nursing personnel do not take the time to provide care. Sixth is, if the child doesn't have close physical contact with another human being, they may result in emotional trauma. Next is, beneficial effects of hospitalization. The most obvious effect in the recovery from illness. The most obvious effect is recovery from the illness. Hospitalization provide an opportunity for the children to master stress and feel competent in their coping abilities. Hospitalization Hospital environment can provide new socialization experiences. Child can broaden broaden their interpersonal relationships. Psychological status of child also maximized. Now move on to impact of hospitalization on child's family. Hospitalization of child is a break in the unity of a family. Parents whose children have been admitted to a hospital, they feel not only separated from their child, but they also feel that inadequacy of their care, providing the care to the children by the doctor and nurses. They feel anxious, anger, fear, disappointment, self-blaming, and possible guilt feeling due to lack of confidence and competence for caring the child in illness and wellness. They think they are not competent, not able to care their child properly. Then some of the causes of parental anxiety related to hospitalization are the fear of following. This is strange environment in the hospital, unknown environment of a hospital. Sometimes parents are not knowing the infrastructure of hospital, proper knowledge of not having the proper knowledge of hospital environment. Then they are very anxious. Separation from the child, unknown event and outcomes, the suffering of the child, spread of the infection to other family members, unbearable financial conditions. Society will look upon the illness. Most importantly, society will look upon the illness as a reflection of something wrong with the family. The society thinks that the mother, father, or the other family members doing something wrong that will lead to illness of the baby. Next, we will deal with stressors of hospitalization. What all the stressors come when the child is hospitalized? First is separation anxiety, second is loss of control, third is bodily injury and pain. First is separation anxiety. This is in infant and toddler. In separation anxiety, there is 3 phases: phase of protest, phase of despair, phase of detachment. Now, first is separation anxiety. In this phase of protest, in this children react aggressively to separation. Child cries, loudly cry, aggressive, and then refuse attention of anymore. जब भी हम बच्चे को टच करने जाएंगे या कुछ भी उसके लिए हेल्पफुल करने जाएंगे तो वो आपको रिफ्यूज़ करेगा. देन क्राई एंड स्क्रीमिंग फॉर देयर पेरेंट्स इनकंसोलेबल, continuously search for their parents, clings to parents when they reach, and avoid or reject contact with anyone else. Toddler verbally and physically attack strangers, attempt to escape from the area to find parents. These manifestations may last from hours to days and ceasing only with physical exhaustions. Now, phase of despair. During this phase, crying stops and depression is evident. Child is less active and show no interest in food or play. He looks sad, lonely, isolated, and apathetic. Child may regress to earlier behavior like thumb sucking, bedwetting, or use of a pacifier. Child's physical condition may further deteriorate from refusal to eat, drink, or move. Other usually misinterpreted this phase for children's cooperation and adjustment to the hospitalization. Now, phase of detachment. Child appears to have finally adjusted to the loss, started showing more interest in the surroundings, play with other, and seems to form new relationships. Then second is loss of control. Children perceives a great amount of control according to their age group. New situations like hospitalization decreases the amount of control a child feels. The feeling of loss of control causes a threat and can affect children's coping skills. So that the nurses must have an insight into the type of environment conducive to child's optimum growth. The major area of loss of control: physical restriction, altered routine, and dependency, varies according to the different age groups. Then loss of control in infants. Infants attempt to control their environment through emotional expressions such as crying and smiling. According to Erikson, infants develop a trust while overcoming a sense of mistrust. Infants trust that their feeding, comfort, stimulations, and crying needs will be met. So, the care that the infant receives matters. The trust acquired in infancy provides the foundation for all succeeding phases. Inconsistent care and making changes in the infant's daily routine may lead to mistrust and loss of control. Like if you are uh, allowing baby to play for 2 hours and suddenly you say that today you will not play, um, with any reason you will say you could not play today or tomorrow. The baby feels that बेबी ऐसे फील करेगा कि पहले आपने उसको बोला था कि आप खेलने दोगे बट बाद में आपने उसे मना कर दिया. दिस इज ट्रस्ट वर्सेस मिसट्रस्ट. Then loss of control in toddlers. Erikson, the developmental task of toddlerhood is acquiring a sense of autonomy while overcoming a sense of doubt and shame. Their behavior ranges from motor skill, play, interpersonal relationship, ADL, and communications. When their pleasure are not met, they perceive hospital routine and caregivers as obstacles. They react with negativism and temper tantrum. टॉडलर जो होते हैं वो गेम्स खेलना पसंद करते हैं, पर्सनल इंट्रैक्शंस, इंटरपर्सनल रिलेशनशिप में अच्छे होते हैं टॉडलर्स. तो अगर हॉस्पिटल रूटीन जो होता है और केयर गिवर्स जो किसी चीज़ के लिए उसको मना करते हैं, तो बच्चे को क्या लगता है उसमें नेगेटिव थॉट्स आ जाते हैं, उसके लिए वो नेगेटिविटी आ जाती है और वो उसको ऐसा लगता है कि उसको अपनी मर्जी से कोई काम नहीं करने दिया जा रहा है. और जब उसको ऐसा लगता है कि मैं कुछ चीज़ नहीं कर पा रहा हूँ तो वो उसको एग्रेशन में, टेम्पर टेंट्रम्स, एग्रेशन में कन्वर्ट कर लेता है. Toddler rely on the consistent and familiarity of daily rituals to provide a measure of stability and control in their life. Their rituals include eating, sleeping, bathing, toileting, and play. They need proper daily routine. They have to follow their daily routine in a consistent manner. When this daily routine is disrupted by hospitalization, their principal reaction is regression. Rigid schedule, altered caregiving activities, unfamiliar surroundings, separation from parents, and medical procedures decreases the toddler control over their own world. Prolonged loss of autonomy may result in passive withdrawal from interpersonal relationship and regression in all area of development. अगर बच्चे के डेली रूटीन को ज़्यादा टाइम तक डिस्टर्ब करते हैं तो उसमें एक उसका ऑटोनॉमी हर्ट होता है, जिसके कारण बच्चा जो पर्सनल इंटरपर्सनल इंटरेक्शन है उससे विड्रॉ होने लगता है, ज़्यादा किसी से बातचीत नहीं करता है और डिप्रेस टाइप रहता है। लॉस ऑफ कंट्रोल इन प्री स्कूलर्स. Preschoolers experience loss of control when they are physically restrained. Routines are altered and when they feel enforced dependency. They take their hospitalization as a punishment or their wrongdoing. समटाइम्स जब हम लोग बच्चे को रिस्ट्रेन करके रखते हैं या उसको कोई चीज़ करने के लिए फोर्स करते हैं कि आपको ये चीज़ करनी है, तो वो बच्चा उस चीज़ को एज अ पनिशमेंट परसीव करता है। उसको लगता है कि मेरे को हॉस्पिटलाइजेशन इसलिए दिया है क्योंकि मैंने कुछ गलत किया था, मुझे उसका पनिशमेंट मिला है ये। नाउ school age children. School age children are movers and seekers. They control their self care and typically are highly social. They like being involved and most fill their days with activities. Illness can change all these patterns. Friends are very important to this age group. Then, loss of control in adolescence. Control is very important of this adolescent age group. Understanding this issue is key when caring for when we are caring for adolescents. Adolescents are unsure if they want their family with them or not. They are always confused that they need their family or not. At the time of sickness, they confuse that they need family or not. Some enjoy the freedom. Ideally, the peer groups will support the ill friend. They want to hear from their friends frequently. Giving the adolescent some control avoids endless power struggles. Control issues can cause a major conflicts between adolescents and parents. Parents often feel like ping pong balls as they are bounced back and forth by a child whose wants help one and reject it the next. एडोलसेंस एज में जो होता है ना, पेरेंट्स लोगों को ऐसा लगता है कि बच्चे एक टाइम हमारा हेल्प मांग रहे हैं और दूसरे टाइम जब आप हेल्प करने जाओगे तो उस चीज़ से उस हेल्प को रिजेक्ट कर रहे हैं ना। थर्ड इज बॉडीली इंजरी एंड पेन. व्हेन अ चाइल्ड एंटर्स इनटू हॉस्पिटल, ही इज मोस्ट कंसर्न अबाउट पेन एंड बॉडीली इंजरी. ये वाला सिचुएशन सबको फील होता है. एक अडल्ट पर्सन भी अगर हॉस्पिटलाइज हो रहा है या हॉस्पिटल जा रहा है तो उसको सिरिंजेस, प्रिकिंग, निडल्स, ये सबसे एक फियर होता है कि वो निडल उसको लगेगा तो पेन होगा. बॉडी पार्ट में इंजरी हुआ है तो वो कुछ ठीक होगा कि नहीं होगा, फिर से नॉर्मल वर्क में आएगा या नहीं आएगा. When children experience pain, they become reluctant to enter the hospital. एक बार जब बच्चा हॉस्पिटल आ जाता है और उसको उस समय इंजेक्शन लगा होता है तो वो चीज़ को वो याद रखता है, और जब भी उसको हॉस्पिटल आना पड़ता है ना तो वो रोना शुरू कर देता है. वो हॉस्पिटल नहीं आना चाहता है क्योंकि उसको पता है कि हॉस्पिटल आने से पेन होगा. Children in different age group react differently to the pain. Now first is infant. Infant may express pain by assuming certain positions such as squirming, writhing, jerking. Some infants may cry loudly after the procedure whereas others are specially calmed by a gentle hug. Research has found that infants have stored acute acute pain experiences and react in subsequent painful event with highlighted behavior respond to pain. Older infants react intensely with physical resistance and uncooperativeness. Then toddler. The, the, the older the child, the more elaborated intense is the protest. The child cries, climb to the parents, kick and gently create a scene. बच्चे जब हॉस्पिटल आते हैं और उनको इंजेक्शन लगाना होता है तो जैसे ही वो इंजेक्शन देखते हैं तो उन लोग का रोना, चिल्लाना, हाथ पैर चलाना, मारना, ये सारा सीन क्रिएट करना शुरू हो जाता है. Parents need to understand that his behavior is a sign of healthy parent-child attachment. The toddler may resist bedtime and eating, temper tantrums, regression, स्पेशली टॉयलेट नहीं जाएंगे, खाएंगे नहीं, ये हर चीज़ों को रेजिस्ट करने लग जाते हैं. आप मुझे एडमिट करोगे तो मैं खाना नहीं खाऊंगा. By the end of the toddler period, a child is able to locate their pain but not able to describe the intensity of a pain. Now, preschooler. The preschooler have fear of injury and pain. They react with verbally abusing their attackers. Her nurses need to understand that this is just an expected normal behavior from a preschooler. Sometimes they may try to avoid the event by citing some excuses. Example, I have to go to bathroom. समटाइम्स ऐसा होता है, बच्चे आते हैं प्री स्कूलर, वो कभी कभी अब्यूज़ करते हैं, वर्बल अब्यूज़ करते हैं. तो उस टाइम पे नर्सेस लोगों को गुस्सा नहीं होना है. हमको ये समझ के चलना है कि ये इस एज के बच्चों का एक नॉर्मल बिहेवियर है. इस एज के बच्चे लोग समटाइम एक्सक्यूजेस देते हैं, जैसे मैं वॉशरूम से आ रहा हूँ. जैसे ही आप इंजेक्शन प्रिपेयर करोगे वो बच्चा बोलेगा मैं वॉशरूम से आ रहा हूँ, मैं पानी पी कर आ रहा हूँ. ये कॉमन एग्जाम्पल्स हैं. द प्री स्कूलर फियर म्यूटिलेशन. द चाइल्ड हु हैज़ सर्जरी एक्सपीरियंस increased fear. The child also afraid of intrusive procedure, and because of their literal interpretations of word, they often imagine treatment to be much worse than they are imagining can go wild during illness. This age child has attained a good deal of independence in self-care, and they accept to maintain their independence in the hospital. And this is for school going child. Like the toddler and preschooler likes familiar routine and rituals and may show some regression if not allowed to maintain some areas of control. Preschooler may believe that the illness occurs because of some personal deed or through thought, or perhaps just because the child touches something or someone. This can lead to feeling of guilt, shame, and increased stress at the time when the child has coped with several other stresses. The school-age children able to describe their pain with words. Most of the time, they demand explanation of procedure from the caregiver. Be aware of non-verbal clues a serious facial expression, a half hearted reply of I am fine, silence, lack of activity, or social isolation as sign of the need for help. Older children may be more concerned with missing school and the fear that their friends will forget them. School age children are more relaxed about having a physical examination on having the eye or an ear examination, but are uncomfortable with any type of genital examination. They want to know the reason for the procedure and ask relevant question about their illness. They can relate actions to becoming ill, like not wearing a coat or eating nutritiously may cause illness. Then adolescence. Body image is paramount during adolescence. Because of the development of secondary sexual characteristics, adolescents are concerned about privacy. They may react to pain with much self control, but they will not tolerate lack of privacy during procedures. They tend to observe all the procedure you demonstrate on them. One has to look for the physical indications such as adolescents may one has to look for the physical indications such as limited movement, excessive quiet or irritability, as adolescents may not disclose their level of pain to others. Experiences to this age is crucial. Therefore, illness or injury that changes their perception of themselves can have a major impact. Now move on to measures to make hospital environment friendly for children. First is provide good illumination. Keep floors clear of fluid or objects that might contribute to any hazard situation. Use non-skid surface in washroom. Familiar with the area specific fire plan. Secure all windows. Blinds and curtain cords. Keep plants away as they harbor germs, negative bacteria and molds that may affect immunocompromised children. Electrical equipment should be in good working order. It should be used only by professionals familiar with the use and kept away from children. Furniture should be checked for safety. Infant, young children, and those who are weak, paralyzed, agitated, confused, sedated, or cognitively impaired should never be left unattended or on treatment table, weighing scales, or in treatment areas. Prevent from prevent fall from the beds and cribs by raising the side rails. Assess the safety of toys. Toys should be appropriate to appropriate to child's age, condition, and treatment. Setting limits is essential, and children should know where they are permitted to go and what they are supposed to do. Ensure safe transportation for children with or without the unit. This is a rough view of a play area or a decoration of a child friendly hospital. Now, a child friendly environment should have facilities, equipments, and medication tailored to fit the need of a children. All facilities, all equipments, toys, medications should be there for a child friendly environment. Bright color, themed decor, and plenty of area and opportunities to play. What are the nursing care of a hospitalized child? In infant age group, there is trust versus mistrust. In this, a nurse has to encourage parents to visit, rooming in, encourage parents to participate in care, teach parents procedure they are capable of doing, discuss arrangements of care of other family at home, try to stimulate home routine, assign some nurses. Allow parents to be present during procedures and comfort afterwards. Keep frightening objects away from view, providing shielding, soft talking to soothe. Play close attention to light and sound stimulations. Then in toddler, there is autonomy versus shame and doubt. In this, a nurse has to encourage parents to room in and if have to leave when awake and leave something of meaning with child for support. Provide warmth and support. Explain to parents and stay child in. Bring infant security objects, favorite toy, blanket. Set limits, give choices on simple decisions. Teach parents that child may regress, may promote potty, chair if child is trained. Promote ritualistic behavior of bedtime. Teach parents about hazardous crib chair, toy equipments. Be sure to supervise when out of crib. Now preschooler. In this, initiative versus guilt. Acknowledge child's fear regarding hospitalization. Orient the hospital. Spend time with the child. Build trust. Encourage presence of parents if possible and encourage to participate in care. Provide comfort and support. Assess his likes and dislikes among food items. Give small portions. Make environment comfortable and accept messes. Encourage intake of fluid with games. Provide consistent environment. Reinforce coping behavior. Provide with as much mobility as possible. Provide play and diversional activities. Avoid intrusive procedures as much as possible. Assist assist child's perception by asking to draw a picture and tell about it. Then school age. Industry versus inferiority. Ascertain what child knows. Clarify using scientific terminologies and how body functions. Direct question more to the child when teaching them. Help master over finding of inferiority. Using audio visuals, pictures, body outlines. Suggest way of maintaining control. Deep breathing exercises, relaxation, yoga. gain cooperation, give positive feedback. Include in decision making, like ask for what time you want to bath, in what time you want to play, where you want to take injection, like this. Encourage active participation. Plan child day if possible with child's input. Maintain clear and consistent limit. Allow for privacy. Adolescence. Identity versus identity diffusion or role confusion. A nurse has to assess knowledge, encourage questioning regarding fear or any risk, involve in decision making. Ask if child want parents there. Make as few of restrictions as possible. Suggest a way of maintaining control. Accept regression to more childish way of coping. Give positive reinforcement. Provide privacy for care. Encourage to perform normal grooming. Allow favorite food to be brought in if not on a special diet. Now move on to care of hospitalized child includes. In this, prepare for hospitalization. Second is prevent or minimize separation. Whenever possible, allow parents for rooming in. Minimize loss of control. Allow child to actively participate in on every procedure. Prevent minimal bodily injury. Allow for regression. Provide pain management. Provide for developmentally appropriate play activities. Maximize potential benefit of hospitalization. Now, play therapy. It is very useful for reducing stress and anxiety. Great for socialization, motor skill, and intellectual development. In hospital, play with children can also create understanding and serve as a distract as well as help in building rapport and providing a positive experience. Encourage development and independence, relieving stress and boredom, helping to prepare for procedure, normalizing the environment, breeding familiarity with hospital equipments, providing opportunities to talk and listen. Then what are the advantages of play to a hospitalized child? Therapeutic. Activities are guided. Emotional outlet. Act out real stressor. By playing, the child will actively guided. Emotional outlet. When child is playing, he or she talk about their stressors. Used to teach child prior to situation. Enhance cooperation using during an unpleasant procedure. Therapeutic play techniques for different age group. In infants, cry mobiles, soft toys, music. This all used for an infant. Toddler, play peekaboo, hide and seek, read familiar stories, play with dolls that have similar illness as them, puzzle, building blocks, push and pull toys, play with safe hospital equipment, bandages, stethoscope, syringe without needle. Remove when finished play. Preschooler Preschooler play with the safe hospital equipments. Crayon and coloring books, puppets, felt and magnetic boards, flat and magnetic boards, book and recorded stories, videos. Then school age, doll, hospital equipments, board games, craft works, books, computers. Then what all strategies to coping and normal development? What all the strategies a nurse has to use for coping and normal development of a child? During hospitalization, care of a child focuses on meeting physiological needs, not only on meeting physiological needs but also meeting psychological and developmental needs. First is child life program. Focus on the physiological need of hospitalized children, professional child life specialists, paraprofessionals and volunteer staff this department. A child life specialist plan activities to provide age appropriate playtime for children, either in playroom or child's room. Child specialist and nurse formulate plan together to assist children with particular needs. Second is rooming in. It is a practice of having a parent stay in the child's hospital room and care for hospitalized child. Some hospital provides cots, other have special built-in beds, and in some institution parents stay in the separate room on the unit. Parents who is rooming in may want to perform all the child basic care for help with some of the medical care. Communication between nurse and parents is important so that the parents' desire for involvement is supported. Foster child parent relationship. Hospitalization provide opportunities for children to learn more about their children growth and development. Difficulties in parent child relationship may result in feeding problem, negative behavior and sleep disturbance may decreases during hospitalization. Fourth is providing educational opportunities and socialization. Illness and hospitalization represents excellent opportunities for children and family members to learn more about the bodies, each other and the hospital care professionals. Hospitalization may offer children a special opportunity for social acceptance. Children may find a sympathetic environment in hospital, although this does not always spontaneously occur. Nurse can structure the environment to foster a supportive child group. Then making a hospital stay happier. For making a hospital stay happier, a nurse has to being honest, open communication and trusting relationship. A nurse has to promote the positives, praises the child for their efforts and encourage their progress verbally and with rewards. Rewards with them Reward them with a favorite toy or a book. Anxiety, practice some relaxation technique like focusing on breathing to calm down or releasing stress by squeezing a ball, distract child by taking through what is happening, or divert their attention with a conversation, favorite story, or activity. This is all about my seminar, Care of a Hospitalized Child. If you have any doubt, please feel free to ask me. Thank you.